Hi, I'm Dr. Gopinathan. I work as consultant hematology and bone marrow transplant here at MGM Cancer Institute and Healthcare. So we all know that hematologist is the one who treats disorders of blood. Having said that, blood is a special fluid structure in the body and it's very unique in that sense. Any disorders of the blood can affect any organ systems of the body because it flows from head to foot. So as hematologists, we see both cancerous and non-cancerous disorders of blood. So if we talk about non-cancerous disorders at the first go, the commonest thing as a hematologist we see is anemia, which refers to decreased hemoglobin in the blood. So the most common cause of anemia again in our own country is nutritional anemia. That's what we commonly see, which has a variety of causes down below, starting from the nutritional cause to various gastrointestinal disorders, autoimmune disorders causing the same. So the commonest test when we see anemia, any patient with anemia, what we do is we do a complete blood count, look for iron profile, B12 and try to identify what is causing the exact reason for anemia and try to look at it. So moving away from anemia to slightly blood production disorders, since in blood we have three components mainly, hemoglobin, WBC and platelets. The most common cause of hemoglobin underproduction disorders include thalassemias and sickle cell anemia, wherein the bone marrow fails to form a good amount of good quality hemoglobin and good quality red blood count. So these disorders are predominantly managed by transfusions and bone marrow transplant. And in the white blood cell category, we have something called as primary immunodeficiency, which in Tamil we call it as Mudhanmai எதிர்ப்பு சக்தி குறைபாடு. And if these diseases are not treated on time, these children can ultimately end up having severe infections and it can turn fatter. And last, we have something called as aplastic anemia, which means all the cell components of the blood don't form in an appropriate manner. Again, these patients come to you with low hemoglobin, because of low white blood cell counts, they develop severe infections, and because of low platelets, they kind of have increased requirement of platelet transfusion and they develop severe fatal bleeding. So all these disorders require bone marrow transplant on time because it is a life-saving procedure for these patients. And last, when we slightly come towards the platelet related problems, the commonest thing again as a clinician we see is ITP, which is immune thrombocytopenic purpura, which means your bone marrow tries to produce more platelets but then they are extremely used up in the periphery, ultimately resulting in low platelet counts. So again, ITP has got various causes. We try to discern what is the exact cause of ITP and treat them. Usually the commonest treatment that we give for any patient with ITP is a short course of steroids followed by immunosuppression. And last, we come to blood clotting disorders, because blood not only has cells, it has something called plasma proteins. So these plasma proteins are very important in carrying our nutrition as well as help us to form good amount of good quality blood clots. So in the blood clotting disorders, we have those disorders which fail to clot blood, which form clot too much. So they are called thrombotic disorders. So again, thrombotic disorders, we have various causes like protein C, protein S, antithrombin 3 deficiency, factor V Leiden mutation, prothrombin mutation, which has to be identified appropriately because these patients need long-term blood thinners for management. Now switching gears slightly from benign hematology to malignant hematology, wherein we only treat cancerous blood disorders. They are broadly classified into three categories, which are leukemias, lymphomas and myelomas. Leukemia means it's a acute white blood cell cancer. So we have two types there. We have acute lymphoblastic leukemia and acute myeloblastic leukemia. Both of these patients need a long-term chemotherapy of almost 6 months, and depending upon the risk stratification that we do, they will go in for bone marrow transplant. Then second, we have lymphoma, which is Hodgkin's and non-Hodgkin's lymphoma, of which Hodgkin's is a better one because most of the patients get cured only by chemotherapy, whereas non-Hodgkin's lymphoma, some do go in for transplant. And the last category of blood cancer that you are going to see is myeloma, which is a commonest disorder that we see in the community in the elderly age group, which affects your blood, bones, kidneys and all the other multitude of organs, which needs autologous transplant, and that is the commonest transplant procedure that we perform for any hematological disorder in the current era. Apart from that, there are some rare blood related cancers like histiocytosis, Waldenstrom's, amyloidosis, myelofibrosis. Again, these need a tailored management which depends from patient to patient. So overall, the chemotherapy that we do, the targeted therapy that we do, the immunotherapy that we do, the transplant approaches we do have changed a lot over the decade, and with the advent of so many advancements in both diagnostic test and treatment modalities, the outcomes of patients with hematological malignancies have improved a lot. So wish to serve you in future, and thanks a lot for the opportunity.